Hello, everyone, and welcome to today's Triple Tree Thought Leadership session. Before we get started, I'd like to go over a few items to help you get the most out of today's session. You have joined the presentation listening using your computer speaker system by default. If you'd prefer to join over the telephone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's panelists by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation. We will address these questions throughout today's discussion. I'd now like to introduce Michael Carroll.
Good morning and welcome to Market Insights Live. For the second consecutive year, Triple Tree is proud to present this collection of important industry conversations. Today's session is focused on what it will take to create winning virtual health strategies in this new era of virtual health. A reminder that the views and opinions expressed in today's discussion are those of our panelists and do not necessarily reflect the official position of Triple Tree or its affiliates. To begin today, I'd like to introduce my colleague, Elliot Amundsen, who will provide some grounding about the virtual health ecosystem. Cheyenne, you can advance to the next slide, and Elliot, take it away.
Thank you, Michael, and good morning, everyone. This is Elliot Amundsen speaking, and I'm a director at Triple Tree. As we begin our panel discussion in a few moments, please feel free to submit questions in the questions pane on your control panel, and I'll find opportunities to weave those questions into the discussion with our panelists. To help set the stage for today's panel discussion on the realities of creating a virtual health strategy, I'm going to walk through this slide and another slide with some visuals to help define what we mean by virtual health and how those components can fit together into a cohesive strategy. So for this first slide, what we wanted to do is to level set and give our audience a perspective into what we mean by virtual health. It's very easy to simplify virtual health into a very narrow view of video or telephone-based physician and patient encounters. What we want to do in today's discussion is to open up the aperture of what we mean by virtual health to include a wide range of technologies and tech-enabled services that span across a number of different capabilities in the ecosystem of what people are calling digital front door or triage and intake, virtual second opinions, telepharmacy, patient communications, in-home monitoring, digital therapeutics, and a number of other what have become household buzzwords over the past 12 to 24 months. This visual is just a representation of various subsegments in virtual health. There are certainly more beyond this, but as we can all imagine, as a payer, provider, employer, or technology innovator, trying to look at this ecosystem and arrange these puzzle pieces into a virtual health strategy can be a daunting measure. So if we would move to the next slide. As we took a step back as Triple Tree and looked at the ecosystem of capabilities and players, we came up with this framework as a way to organize the various subsegments into the patient journey and the ultimate care delivery workflows. So the first bucket on the left is what we're calling the digital front door or triage and intake. And these are subsegments of virtual health that help patients access care in a data-driven, consumer-friendly manner, and ultimately route those patients to the right provider at the right time and in the right modality. In the second bucket in the middle of the slide, we think of virtual care delivery on a cost and severity spectrum, beginning with self-management tools on the top end, and ultimately, as patient severity increases, the need for in-person or hybrid in-person virtual care increases, which ultimately drives costs as you move from 1 to 7 in that middle bucket. And then finally, on the right side of the slide, we include virtual health subsegments that are focused on in-home monitoring, longitudinal patient engagement, post-encounter care transitions in this third bucket of home-based patient monitoring and engagement. And as we've seen over the last 12 to 24 months, a lot of these companies and categories are coming together through partnerships and M&A as health systems, employers, and payers, as buyers of these technologies, are demanding a more cohesive, longitudinal, and broad set of capabilities. And platforms in these spaces are attempting to deliver on that. with the Teladoc and Livongo merger being a great example of that. And we'll have one of our panelists be a representative on behalf of Teladoc today. These three segments of virtual health ultimately need to overlay and integrate with a broader universe of technologies, vendors, and workflows, whether it be existing EMR technologies from a clinical perspective or more RCM related functions like transparency, financial transparency, and payments to ultimately tie together the patient experience, clinical workflows, and administrative workflows. I hope this serves as a helpful framework to begin our discussion today on how to create a comprehensive virtual health strategy. It'll be interesting and fascinating to hear perspectives from those in the industry solving these problems and pursuing these opportunities together. With that, if we could move to the next slide, I'll pass it over to my colleague, Jason Grace, to introduce himself and our panelists.
Thanks, Elliot. Good morning, everyone. My name is Jason Grace, and I'm a managing director in our investment banking advisory practice here at TripleTree. We're so thrilled to present this panel discussion today, and I know you'll all enjoy the various perspectives of our diverse group of panelists. So first, I'd like to introduce them. First of all, Kim Duck is Vice President of Global Benefits at Dow Jones. Kim she oversees global health and welfare, retirement and pension plans, leave of absence management, deals and discounts, as well as ergonomics and wellness. So Kim has joined us today to represent the employer view on virtual health. Welcome, Kim. Paul Marchetti is the Senior Vice President of Healthcare Management at Anthem. Paul has more than 25 years of payer and provider experience in healthcare delivery systems, business operations, product development, and population health. In his role, Paul oversees provider networks, value-based care initiatives, clinical operations, medical cost analytics, and more. So Paul, on behalf of Anthem, is joining for the payer perspective. And Dan Trencher is Senior Vice President of Strategy at Teladoc. Dan leads corporate strategy and is responsible for developing Teladoc's long-term strategic vision. Under his direction, his team ensures the alignment of short and long-range plans, strategic investment roadmaps, and channel-level strategies and objectives. So welcome, Paul, Kim, and Dan, and we're really looking forward to the session today. And to start, it'd be great as the world has changed a lot over the past 13 months or so. We'd love to just hear from each of you on what we've learned over the past year related to virtual health, and what do you think the market's priorities are going forward? Paul, would you like to start?
Sure. Thank you, Jason, and good morning, everybody. Yeah, I think one of the clear things that we saw, the reality is when the pandemic started a year ago, virtual health really took off. We've seen the relationship between virtual care and its impact on total costs. Total costs came down by 17%, yet we saw, the emergency room visits down. We saw physician visits down, yet, virtual care was on a percentage basis, 1,000% increases. And that's a good thing because I think it lifted the lid off of what consumers realize now, the convenience access to care through a virtual platform. So that was the first thing. I think the second thing is, it really promoted broad access in terms of, we saw rural communities of our membership that was able to access care conveniently, safely, and in those communities, we've gotten feedback from our customers that they realize now that is, rather than driving 40, 30 miles to get access to care in the traditional sense, they realize now that both, medical and behavioral care can be sought after from a virtual standpoint, and that's a good thing. So that's the second thing. The third thing is the importance that we see is virtual care is a component of what we see as an overall value-based strategy of really shifting or evolving the delivery system from a fee-for-service model to a value-based model where reimbursement is based on outcomes and higher quality performance. So virtual care needs to be a key component going forward into that strategy of working more closely with physicians and strengthening the physician and patient relationship. And the last thing is, one of the things that was interesting that we saw was not all providers had invested in telehealth capabilities. So when the pandemic hit, we actually were able to utilize our telehealth platform, Live Health Online, provided by Amwell, really where we recruited over 2,000 physicians. We trained them and set them up on our platform so that they can continue to see their own patients, before, there was more of a comfort level on face-to-face. So what's recognized now by those providers is they need to begin to invest in telehealth going forward. And so we want to help support that, primary care as well, in addition to specialist services. So Jason, all of those things were great learnings. I think we've just broken the seal now on what a new day is for telehealth and the use of technology for more convenient and high quality access to care.
Great, Paul. Thank you. And Dan, we know you've learned a lot at Teladoc over the past year, given huge spikes in volume, but I'd love to hear your perspectives as well.
Yeah, thanks, Jason. Certainly have and agree with everything Paul shared. I've been with the company almost 10 years. And so we've been saying almost that entire time that one of the great things about being in virtual care is we're just scratching the surface on the impact it can make and how it can be used. And I'd say the first thing we learned is we were sort of right. And as we saw out of necessity, in many cases, virtual care being employed much more broadly in 2020 and into 2021. We were starting to just get a real glimpse of the potential for how virtual care can increase access with high quality care and obviously, reduce cost as well. What we saw, sort of the pattern we saw was it started, of course, with an acceleration of consumer adoption, right? And we don't think that's going back to where it was before. We'll see where it sort of settles out. But some stats we saw that over 40% of consumers utilized telehealth in, let's say, December of last year, sort of towards the end of the year. And that's clearly at an aggregate level, orders of magnitude more than the industry saw, before that, if you include all consumers, within the United States. And, what we also saw, which was great, was that consumers said that their telehealth experience was a great experience. That I think 80% plus said it was equal to or better than experiences they've tended to have in person, which is terrific. That means they had a great experience and they'll keep using it. And providers became engaged. We've always had a network of providers, of course, that have been engaged through our service, but we also enable providers to utilize technology and software and hardware to see their own patients. And we saw obviously very rapid adoption. Seen stats, 85% of visits were done virtually, and so providers kind of were thrown into the fire a little bit to get that experience, and they saw the benefit. And I think in many cases were surprised by the scope of care that could be delivered virtually, and I'm sure we'll talk more about that. But sort of in this trajectory, we then saw consumers, accessing and turning to virtual as their first point of entry into their healthcare journey. And, with that, their expectations for healthcare are changing, right? Just like our expectations around shopping, our expectations around banking, our expectations around booking travel, any of those things have completely changed over the years. And it was time for that to happen in healthcare as well. And so where that's led us, as we've seen from a B2B market perspective, the demand amongst employers, amongst health plans, amongst providers for more seamless, easy to use virtual care solutions for whether it's their members or their employees or their patients, and of course for a healthcare provider for their physicians as well, at much different scale than they ever would have thought they needed, prior to the pandemic. So lots in there, but to unpack, but that's sort of what we've seen.
Great. And Kim, I'd love to hear from you as well on what you learned at Dow Jones about virtual health in the past year, but also just some of the things that maybe surprised you or maybe some things that disappointed you about how a virtual health was rolled out to your employee base.
So, there's so many learnings, right, over the last year. and probably the most overused phrase, right? Unprecedented. But if you think about how the workplace has evolved, all of a sudden we got thrown into it and we were able to show employers that employees can work from home and still not lose productivity, still be able to achieve great results. I think we saw that too, that immediate jump from a healthcare perspective, because prior to the pandemic, your thought process was always it had to be in person, or at least the majority of it had to be in person to get quality, good care, just like you needed quality, good work. You wanted to be able to see your employees. So the pandemic, I think, threw all of us into a brand new scope where you saw you don't need to be face to face to be able to get that quality care. And it really, really showcased as an employer that I can't communicate enough. That every single time I turn around, whether it's a newsletter, is it just a general communication, how many voices need to be saying and communicating my message for it to be heard? And we moved to a new telemedicine provider the prior year, so the beginning of 2020. And we have had adoption. It's been slow, but we knew that with our population because they're just, ironically, for as digital of a platform as our products are, our folks tend to not really resonate with digital, whether it's digital solicitations for programs or the digital program itself. But to Dan's point, once people log on and they have that great experience, it hooks them. And so we were able to slowly get our traction. We've all been saying, you saw telemedicine increase. I think our telemedicine increased 8,000% from the prior year, which is insane. And it's because, you couldn't leave your home. You still needed, whether it was acute care or was it ongoing for, for some conditions, but you needed for the first time to really engage with your provider in a different way. And especially when it came to acute conditions and having our telemedicine provider, it's that key experience, right? Like I said, once you had that great experience, you're hooked, and you just needed that one opportunity to see that you're not getting lesser care. It's just delivered to you in a different way. But that doesn't happen if I don't say the same thing, or my CHRO doesn't say the same thing, or your boss doesn't reinforce with you that this is a really good opportunity for you. So communication is definitely key for us.
Paul, you mentioned earlier behavioral health as a area that saw a lot of benefit because of virtual health. I'd love to hear a little bit more about that and why you think that is, and maybe transition with that. We've always seen a lot about urgent care or primary care kind of being where the entry point is in virtual health. But I think over this past year, we've also seen a lot of expansion very rapidly in specialty care. So I'd love to hear from you all about what specialties you have particularly resonated in this virtual environment.
I'll start. Thanks, Jason. I would, as it relates to behavioral health, so historically, behavioral health telehealth visits was less than 1% of the telehealth visits was behavioral health. This is pre-COVID. When COVID hit, behavioral health actually began to take over. Actually, at one point, the highest point, 60% of the telehealth visits were behavioral health in nature. Very significant. And while the telehealth visits where there's some normalcy going back to traditional face-to-face, and the telehealth visits have subsided, you still see behavioral health, in the 35 to 40% range, which tells us a couple things. One, it's a huge need and serves as a very convenient, quick access point for people who are depressed, suffering from anxiety, especially during the times that we're in right now. It has served an incredible need and gap that existed. It's also what it's also done is we all know about the historical negative stigmas associated with behavioral health. This allows people to access behavioral health services in a way that is safe, they're comfortable with it, it's still personal, yet it enables them to be able to see and seek care in a way that's confidential, that makes them feel comfortable. That's the first thing. I think the second thing around, I always get a question around, did you see provider abuse in terms of telehealth, does that run along, and people overutilize, providers overutilize? We saw limited instances of provider overbilling and abusive utilization in that area. We have analytics that watch this stuff every day in terms of artificial intelligence, limited abuse there. But back to your question, Jason, other specialties that we see on the horizon that have evolved, and we've actually looked at our own policies, things like physical therapy. That's a specialty where historically it's more of a hands-on approach in terms of care. And what we saw was, and we spoke to the Therapy Association about this, what we saw is actually patients going maybe for virtual care for their therapy, where you could actually have a video interaction with a therapist to do certain exercises or stretching, which is no different than if you were in an office with them. What's happened now, even as things have come back more face-to-face, is physical therapists have said, maybe I'm adjusting my practice patterns where the first visit will be physical in person, and that from that point on, all the other visits can be virtual, provided that the progress is being made. So that's just one example. The other example is technology has evolved for ophthalmology, where you can do retinal scans in a virtual way to determine if there's any kind of damage to the retina. And so all of these technologies coming together have really opened up a new dimension in terms of where healthcare is going. And so those are just a couple examples. Primary care, the last example, virtual primary care, we see as a huge opportunity where oftentimes patients or members would not go to see their primary care visit because they're busy, it's a hassle factor. Virtual primary care is a way to create sustainable engagement between the provider and that patient. So we see it as really an extremely important continuum, in terms of continuously accessing care, getting feedback, making sure they're adhering to their medications or prescriptions, and virtual capabilities allow for all of that.
Great, Kim. Have you guys adopted any specialty care as part of your virtual health strategy?
We have. I mean, our ecosystem is huge, and we really rely on point solutions to help drive some of that care. And I can't support everything that Paul said enough. I think behavioral health is a tough one. I think that the pandemic has unleashed mental health concerns on people who probably wouldn't have put themselves in that bucket before, and being able to offer services. So, we, in addition to having our EAP, which is an employee assistance plan, we work with Talkspace, and that became really important. So not only, video is important, but if I think about some of my employees who probably live in shoebox apartments with probably 3 or 4 other people, and finding the time and the space to have those conversations is really hard, which led us down the path to implement Talkspace through our EAP. And so that's text-based therapy, which again is a huge opportunity for folks when you couldn't leave your home. You may not even be ready to vocalize what these concerns are in the confines of your home and all the voices, in your home. So that's one great thing. And 2, the musculoskeletal piece is ginormous for us as an employer. Before the pandemic, we pay a lot of money on an annual basis for MSK. So we also implemented a program with a vendor called Hinge Health. And while you're not really getting face-to-face, you do have a coach who is assigned to you, who's going to help work through your issues. So really, is it a back issue, neck, knees? And what they do is they send you a tablet with sensors. And so that coach is going to set you up for your exercises. You're going to do them at home. You're going to wear your sensors, and it shows how you're doing when you're doing your exercises. Are you doing them right? You have a coach who's going to keep you accountable. Hey, Kim, I see you didn't do all your reps. Was it okay? Did you have pain? Do we need to amend it, or did you just not have time? And then they're also going to help provide me with education, because that way, if I can change my behaviors in addition to doing my therapy sessions at home, what a greater chance of adherence I have of getting better. And I think that's really important, because from a healthcare perspective, a lot of times you'll see that physical therapy is allotted those 25 visits before they go back and they require some additional documentation. But you don't know how often your physical therapist is submitting your claims. You don't know how quickly you got to 25. And now, did you send the chart notes? Did you send my x-rays? Like, you can, as a participant, you can really kind of stumble on that. And this helps you get out of that, because it's just you and your coach and your tablet and your sensors, which really can move you down a good path without having to interrupt your daily life. You could do it at the gym, you could do it at home. It just makes life easy. And I think that's the whole piece. And two, about Paul's point about primary medicine, we also have another provider that does both on-site, and there's a virtual piece connected to it. I mean, it's all about fitting your benefit journey into your life. If it's too hard, if it's too complicated, if there's too many barriers, and barrier can be time, then you're not going to do it. And how can we make that simpler? How can I make it easier? How can I take that barrier out of the way, so you not only have a good experience with my service, but you're living your best life? And I've helped you do that with some programs that are easy and at your disposal.
Dan, clearly Teladoc made a pretty bold move in expanding capabilities to address people with chronic conditions and other specialty needs via the merger with Teladoc. So I'd love to hear how those expanded capabilities of both companies coming together have changed how you've approached, as an organization, care for more complex patients.
Yeah, thanks, Jason. Definitely, it was a busy year last year in a lot of ways. And so, as you said, we did come together and merge with Livongo, which brought leading digital chronic condition management sort of capabilities into the Teladoc offering. And I'd say it actually builds right on the conversation we were just having. Primary care from a virtual care perspective has really been urgent care for a long time. And what we saw in 2020 was the dramatic expansion of what virtual primary care really can mean, right? So it's really full end-to-end primary care of prevention, screening, and chronic condition management, as well as acute care and referrals into, when community care or in-person care is needed. And so on that chronic condition side, we actually rolled out our virtual primary care offering in pilot last year and sort of, commercially this year in 21. And one of the fascinating things we saw was that we were able to create or diagnose people through virtual primary care with chronic conditions that had previously gone undiagnosed, whether they hadn't sought care before, or they'd only used a sort of urgent care type setting. So these are patients with hypertension, patients with diabetes, and similar sort of chronic conditions that we were able to diagnose, often through devices that we were able to, blood pressure cuffs and other sorts of things that would gather that data, and then engage the consumers in care plans, virtual care plans with our virtual care team that leads to helping with their specialty care or sort of extended primary care needs. And so really able to make a difference. And that's sort of the promise of bringing together the Livongo and Teladoc, is really having that integrated approach that really extends primary care to be able to manage those chronic conditions. And we see it, a really powerful component also is it's more than just a visit. Right, it's between visits that really drives results in chronic condition management. And so having the integrated devices, being able to make use of that data, and really using data science and AI in the background to prompt and sort of nudge consumers to help take the actions that are sort of best for their health. And we talk about sort of empowering consumers to be able to do that. We think that's a key ingredient and is going to be really pay dividends over the long term, because often virtual care has been sort of reduced to just a visit, and that's not going to cut it if we talk about sort of managing population health and chronic conditions over time.
And Jason, if I could build off that for a second, because I think Dan makes a great point about the chronic condition management, and the integration of those type of programs with, artificial intelligence, enhanced predictive analytics capabilities, along with an integrated, population health and value-based strategy, really takes that, gives the provider information they've never had before in terms of what does the population of the community look like? Where are the sickest of the sick? Who are the people that need access? And really a kind of a broader continuum of chronic, management. And then using virtual health as a way to engage them in a more effective way is really kind of where it all comes together. So the example I always give is you could take a member who's diabetic, and they could have a blood sugar level remote patient monitoring device that automatically checks their sugar levels on a regular basis, sends that information electronically to the physician that they're attributed to. And then also, if in the event that the blood sugar level, there's a pattern of high risk or it reaches a high risk level, that automatically can trigger an alert to the physician to make immediate outreach to that patient or that member and one of the quick ways to do that would utilize virtual health as telehealth as a way to engage that patient immediately to say, hey, Paul, we see your blood sugar levels are up. Are you feeling okay? What happened? Did you change your diet or the nutritional program we had you on? What are some of the things need to see maybe immediately? So that's where the immediacy of information technology backed with the capabilities of a telehealth platform really kind of connect all together.
Yeah, I agree completely, Paul. We know sort of unfortunately, the way care, sort of chronic condition management or diabetes is managed and historically is, once every 6 months or a year, a patient comes in, and if you're lucky, they've got a logbook, right? And then you're asking the doctor to interpret the logbook and whatever data's there and trying to figure out what's going on instead of real-time insights. Right, so that let the doctor do the focus on the doctoring, right, and not on sort of trying to read through logs. So we think that's really powerful and going to be a big part of the empowering and enabling providers to be more efficient with their time as well.
Which I think is so ironic, because you would think that virtual care means you're less interacting, right? But in essence, it actually can bring you closer together and help you have more impactful conversations. To your point, Dan, right? You don't have to worry about, oh, did I bring my journal? Did I make sure? What if I didn't journal it? Like, if the doctor can get that real-time information, what a better kind of conversation. And maybe you're not, maybe you're more apt to make that appointment and keep that appointment and be engaged in that appointment with your doctor, because you're both getting something out of it, because you've used your technology to help push that conversation along. So virtual doesn't mean that it's a lesser care. It doesn't mean that it's less interaction. It's about using that in a much better way to have fundamentally stronger conversations. Yeah.
Absolutely. Well, it looks like we have a question from the audience, Elliot.
Yeah, thanks, Jason. I want to just step in. I think it's impossible to talk about virtual health without acknowledging the regulatory and reimbursement environment, where amidst the public health emergency, a number of things were done to make the adoption of virtual health and telehealth much easier for payers, employers, consumers, providers. This might be a question that goes back to Paul from a payer perspective, but certainly open to everyone's perspective. As you think about some of those temporary public health emergency concessions or improvements that were made both on the reimbursement and the regulatory side, what do you anticipate keeping longer term if you have the choice, or what do you think are the most impactful changes on the regulatory and reimbursement side that could really keep the positive momentum we've experienced as an industry thus far?
Yeah, no, thanks. It's a great question, and so this isn't an advertisement, but I'll just say historically, Anthem reimbursed physicians the same rate for a virtual visit as we do for a face-to-face visit. We always wanted to promote virtual care for all the reasons.
Paul, just to interject, just a question on that. Do you think did physicians in your network know that? Do you think?
Yes. Okay. We make that very aware, because we wanted to promote that, and we wanted them to use that reimbursement level to invest in their own platforms. Obviously, on a broad scale, I mentioned some portion of the network that didn't do that. However, I think the learning there on a go-forward basis is we actually are going to continue to reimburse at that same level. Second thing is we actually are considering increasing the reimbursement for a behavioral health telehealth visit because we think that is, we want to absolutely accelerate the promotion of access for behavioral health services. We have a very large behavioral health network through Beacon, and that's been key. One of the things that I think from a regulatory standpoint can help, I think all payers should consider doing what I just suggested. However, what's most important is if you get into a value-based population health dynamic with the provider community, which is our strategy, where again, not to go too deep, but the payment is based upon you producing higher quality outcomes, not necessarily people coming through your turnstiles. So if you get to a dynamic where a provider is taking risks through a value-based agreement and they are incentivized, based upon higher quality outcomes, then really the fee for the telehealth visit shouldn't really matter. That said, I think the bridge to get more providers investing in the capabilities should have the increased reimbursement. But ultimately, I'm responsible for medical costs at Anthem. I would rather see more utilization being done on a telehealth basis because that's going to reduce the bigger costs of ER visits, fewer procedures, fewer hospitalizations with complications and all of that. And as Dan mentioned before, on chronic management, those are individuals that need that continuing access to care, medication adherence, all the things we talked about before. So I would rather more services be done at the physician telehealth visit level. And so I think regulatorily, I think more pushes on value-based standardization, which are being discussed through HHS, but also, enhancing the reimbursement on a broad basis for telehealth, I think is a good thing.
I'll interject, I think, and Paul, I don't disagree with anything that you just said. I think the ironic thing is on the employee side, right? The participant, the member level side, they're not there yet in their brain to think that virtual health is still quality care. I can get all of the same care, sometimes better care. I don't have to necessarily even leave my home. So from an employer perspective, I have to incentivize them to even use it. And if I made you pay the same copay that you pay going into the office that you would pay getting at home, they're not seeing a good value here for their dollar. So we've had to actually look at how do we incentivize them, meaning does it cost me less to use my telehealth provider versus going into the office? And that does help change behavior. I would expect with time, as they continue to have that excellent service and better quality, and they're having those stronger conversations, that dynamic will be able to flip. But for right now, it's a lesser service in their head, and we need to help drive them into it to help change their mind by the experience. So
yeah, agree.
Yeah, I think it's a really important point, Kim. And as we think about long-term driving engagement with virtual care services, it's always been a matter of creating awareness, creating sort of point in time, remembering you have access to the service when you need it, and then that confidence that it's high quality care that you're going to get. And so you definitely can't leave that last piece out. What I'd also say is, it wasn't a regulatory change necessarily, but the policy changes that employers and health plans, including Anthem and many others, made to make virtual care essentially no cost sharing during the course of the pandemic was really important to making it really easy for people to try it out and get involved. And we've always seen that cost sharing, even small amounts, can have a dramatic impact on utilization. Even $5 can reduce the utilization in half, right? And so we always recommend to our clients, don't be penny wise, pound foolish, and try to save a few bucks here and there if it's going to really reduce people trying virtual care. The other piece I'd sort of share or point out is I think commercial's actually still been ahead of where Medicare has been historically, because the restrictions around use of telemedicine or reimbursement for telemedicine in Medicare have been effectively so stringent that because of requirements around certain geographic areas only, and the patient essentially had to be at a clinical site, not in their home in most cases, that changing during the course of the pandemic was hugely important, right? Basically couldn't have worked without those changes to have Medicare, whether Medicare Advantage or traditional Medicare beneficiary, be able to access care enough virtually. And so certainly we hope that stays in terms of things that are carried forward in terms of regulatory changes that support virtual care use.
Kim, one point I would just add to you, because I thought your point is spot on around the benefit changes. We see, as opposed to kind of going down the path of, hey, let's make benefit changes or design changes at the virtual health level, we're configuring our products around our value-based networks, of which virtual health is a key part of those value-based provider partners. So it's embedded in there. So the employee doesn't necessarily think about lower value. They think about, hey, there's an overall better quality and cost equation here, of which virtual health is a key ingredient in that approach that is being taken by the delivery system.
Yeah, I think the hard thing that people face today is because telemedicine has really been acute care, at least thus far, right? And so that doesn't go back to your primary care, right? It sits over here on this side. So you have this disjointed experience that participants are experiencing. And how do we bring that together? Because the last thing that we want to do is break that relationship. There's nothing more important than you, the patient, and you, your doctor, and the trust and the decisions that need to happen there together. But so we do need to find a way, and to your point, having health systems that have the virtual aspect embedded in it, so it still is providing that full, picture versus I had this condition and this problem over here, and then this is my primary care, and the two shall never meet. I think is your attack of that is a really smart way for the participant, because again, it's that doctor-patient piece that needs to be at the focus, that needs to be at the core of everything that we do, and enhancing to make sure that even if it's not part of the health system, how do I help your doctor know that you have this available? Because the hard thing is right now I'm relying on you, my employee, with all my point solutions to go back and say, oh, by the way, and I have this, I could try that, because your doctor doesn't know. They're not going to call into my insurance carrier and find out that, oh, we have Hinge Health, and oh, we have this telemedicine, and oh, we have this, and oh, we have that. They're just getting the rundown of traditional benefits. So how can we make that go full circle together?
That's great, Kim. I think the other area we've mentioned briefly is the vast data that's created through virtual health, and everyone's got their phone in their pocket, and it can capture data about all your activity throughout the day. We mentioned blood glucose monitoring earlier in the day. Paul, I'd be interested to hear how is Anthem as a large health plan thinking about harnessing all of that data to then inform your provider network and make this all part of an ecosystem that ultimately provides better care for the patient.
Yeah. So the data is a key ingredient along with the technology. Our strategy and what we're doing with the delivery system is, connecting more strongly into their EHR. First off, there's two benefits to that connection. One is we want to remove administrative burden from historical processes like prior authorization, right? We want to automate that, so there's no phone calls, there's no additional, medical records, then faxes that need to be sent over. We want to take all of that away from the provider to make their life easier and our life easier on the payer side. The second part of it, which is important, is what we call kind of bidirectional information exchange. So what I mean by that is the delivery system doesn't have robust analytics capabilities set up. They have an EHR which houses all kinds of clinical information at that patient level. We can extract that information by pulling in the information out of the EHR at the patient level or at the population health level. We run it through our predictive analytics and artificial intelligence and give them back insights that they don't have today. So the way we do that today is we can target, hey, Dr. Marchetti, these 10 patients are the highest risk in your population. They need immediate, they're not adhering to their medications. These other 5 patients will have the highest risk in terms of the need of a joint replacement in the next 6 to 12 months. These other patients have been seeking behavioral health services. Not sure if you're aware of that. We should coordinate a whole person, care plan for them. So that's the kind of insights that physicians don't have. Using technology and the data, we can put that right back. I gave the example in terms of the workflow to trigger immediate action or to trigger outreach to them, virtual health being a core component as to how that outreach could be made in a more convenient way. But it all starts with the information, because we have to know, and we want that provider to know more about their patient than what they know today, which is only when they historically have seen them. And so there's a lot more going on. We're also connecting the information around, social determinants of health in terms of food, disparities, housing, all of those other things that could impact health in a big way, even dental. We look at, there's a strong connection between poor dental health and poor medical health. So by connecting the information on the dental side in at that patient level to create a longitudinal record and sharing that with the physician gives them insights that is robust, and they love it. And the other key point I would just finish on is it's got to fit into their workflow. So giving it back to them, we're doing studies right now with certain pilot providers, how they want to get the information back, what's most useful, so that they can take action on it.
I think the hardest thing. Oh, go ahead, Jason.
I was just going to say, you mentioned earlier you use a variety of point solutions across your health and benefit strategy, and so not to cut you off, please add in what you were going to use to follow up with Paul's remarks. But also, I'd love to hear, are you finding ways to aggregate some of the data from those different point solutions to help inform, your health and benefit strategy?
Oh yeah, 100%. And that's what that was actually kind of the key central message back to Paul. Like, the hard thing is you, doctor, only know what this patient has told you today, right? So if they've omitted something about, I take this other medication, right, that you only know what you know. So the opportunity for virtual health to build, again, that full circle so that the doctor knows it is super important. But also it's really important from a benefit perspective because, we, for example, will look at our insurance carrier on a quarterly basis, and then we look at our point solutions, and you can kind of see, is this point solution doing its job? Have my costs gone down, or has my adherence gone up, right? Because it's not always about reducing your costs. Sometimes it's about having better utilization. So yeah, we definitely do. There are some employers who have, whole data warehouses that come in where you bring all of your data from all of your parties together to help build what does that story look like. And that's really important sometimes as you're looking to sell to because I'm not going to lie, most of my job is being a salesman up the chain, right? What documentation do I have? What's the story behind it? What data points do I have that supports why I feel like we need this new program? What are we trying to solve for? And when you're talking with sometimes your CEO or your CFO or your CHRO, they don't have all that inside knowledge that you have and the knowledge about benefits and how it works in a population of health. So you have to rely on all of those data points that you can bring it together and tell that story, which is not an easy thing to do. And sometimes, like I said, it's sometimes not well received because you're going out and you're spending money. Well, tell me why. Why do we need to be doing this? So having all of that lined up to help, articulate why we need to help our population be healthy makes for a really good business case, right? The healthy employee, the happy the employee, the productive employee.
certainly, as you'd expect, part of our strategy at Teladoc Health is to make Kim's life a little easier, right? Ultimately, so she doesn't need to have sort of a sea of different point solutions that she needs to interact with, or Paul for that matter, or obviously at the member level as well. You shouldn't have to download 15 apps to kind of manage your healthcare. And so we're trying to deliver sort of broader whole person solutions that bring in all those capabilities because it's easier on the user. And also it is so much more powerful being able to have the data shared amongst those programs. So a lot of people talk about sort of building this great sort of marketplace in healthcare, but healthcare is different, right? Because you need the different components to work together. It's not just a series of transactions, right? And that's what's going to drive better outcomes over time. And so, bringing your mental health services together with physical, and not just physician services either. I know we've talked about doctors as shorthand, but, better utilizing clinicians at different levels and everybody sort of operating at the top of their license, whether it's nurse practitioners and otherwise, is really critical as we think about sort of meeting the demands from a supply perspective, for virtual care over time. And I totally agree. The use of data is most critical in all of this. And what we haven't talked maybe about as much is also from the point of view of consumer, empowering the consumer for driving their own sort of, I hate to say, behavior change. And a lot of consumers, patients need help, right? And so there's a very powerful way to use technology and sort of data and AI to speak to consumers in the way that's going to work best for them, to provide those nudges that's going to help them take the steps that are going to help them control their conditions and make the next best decision. Maybe it is that you need to see a specialist in person in your community, but how do you find the right one, right? And how can we use data to really personalize that suggestion for that consumer?
Yeah, I would say the consumer want that personalized experience,
Yeah.
right? My experience isn't the same as the person who lives next door to me. So you, employer, help drive that, help me so I don't have to fumble around on my own, make it personal. So Dan,
And we as consumers are getting more used to that personalization in every other walk of our life. So healthcare, the expectations are changing.
It's interesting, Dan, and Kim's comments kind of underscore the reality of broad change management, right? In terms of there's a change management agenda for employers and for the consumer, right? And so there's a change management agenda in terms of providers and not only the reimbursement model, but adopting data and technology and the connectivity with payers. There's a payer change management agenda in terms of pushing that, making sure that providers are being reimbursed at a level that supports a change of a focus on quality and outcomes versus fee for service. So everybody plays a role in this broken system that we're currently in fee for service. But I think virtual health is one component of a broader change agenda that we all need to adopt, and we'll see progress from it for sure.
Well, Paul, that tees me up well for another broken part of our system that has been further highlighted by the pandemic is just health equity across the United States. And we're seeing it now, especially with vaccine distribution and making sure some of the underserved populations are getting access to vaccines. So Dan, maybe as we're concluding here in the next few minutes, how at Teladoc are you thinking about virtual health being a component to solve some of our health equity challenges in our country?
Yeah, 100%. And we talk about virtual care as one of the great promises of being able to democratize access to care, both in the U.S. and internationally. Globally, we support an initiative called the World Technology Telehealth Initiative that enables specialty care to be delivered, into communities and countries and, areas that are, don't have that access, in Africa and Asia, every continent, and utilizing, specialty services is really critical because they can't get access to the expertise in those local areas. We're also seeing that there are obviously many underserved parts of the United States, either geographically defined or demographically defined. So even the adoption and use of virtual care within the Medicaid environment can really help some of those disparities in access. And it's normally thought of as a rural issue, but it's just as much an urban issue in a different way. You can't just say it's one geography or another where those deserts exist. And so virtual care we're seeing is really enabling more equal access to care in a way that doesn't require somebody to take an afternoon off for work. For some people, that's just you take the afternoon off. For some people, it's not possible, right? And so that it really is critical that some of those social determinants can be really supported through virtual care. And then the last piece is really supporting the way, even in the U.S., you think about sort of hub and spoke models for virtual care on the provider side, right, where there's all this expertise in a premier urban hospital, perhaps, but 150 miles away, when somebody may be having a stroke, you don't have the neurologist there because the rural hospital can't afford that. And so how do you avoid disparities just because of where you happen to be when you have a medical condition, and being able to use the technology and sort of sharing those physician specialist resources across eliminating the space dimension in location dimension can be really powerful. And we've seen, it saves lives every day. And we think it's a really critical piece that doesn't get talked about necessarily as much as sort of the fun consumer stuff. But some of those critical applications of virtual care are saving lives.
Well, that's great. We hope that virtual care certainly can help solve a lot of these challenges, and it'll be great and fun to see how it all evolves. So Kim, Dan, and Paul, thank you all so much for such an insightful and engaging conversation. It's been a lot of fun to hear from all of you, and thank you for your time, and thank you to all of our attendees for joining us today. With that, I'd like to turn it back over to my colleague, Michael Carroll.
That concludes today's Market Insights live session. Again, thanks to all of our panelists, and thanks for attending today's conversation. If you're looking for more information as a bonus and a follow-up to today, we actually have made our new research report, A New Era of Virtual Health, available to all of you who have registered. If you have not yet received your email already, you will receive an email in the next 24 hours with information about how to download this report. Then also, if you're curious to hear any of the replays from our prior sessions or hear a replay of today, you can visit our website at tripletree.com/marketinsightslive. Additionally, we have 3 upcoming sessions throughout May and June. You're encouraged and welcome to register for those. And again, a huge thank you from all of us at TripleTree for joining today. And again, thanks to our panelists for a great conversation. We'll see you in May. Thank you.